Well, let me give you a full update on the coronavirus. There are now more than 74,000 infections in China and over 2,000 people have died. The biggest concentration of cases outside China is still in Japan, in Yokohama, where this ship, the Diamond Princess, has been quarantined for more than 2 weeks. And during that time, more than 600 passengers and crew have tested positive. That's 1 in 6 of those who were on this ship when the saga began. Well, those who've tested negative have now been allowed to leave. Laura Bicker watched it all play out.
One by one, they were put onto buses. Even the buses were separated by what appeared to be kind of plastic sheeting to keep the passengers and the bus drivers separate. But they were taken to central Yokohama, where many, we are told, got onto trains or other buses and used public transport to get home. It is all raising concern that even though these passengers have tested negative for coronavirus, it could spark a further global spread. There have been so many cases where people have been getting this virus, have been shown no symptoms whatsoever, or they've been testing negative for several weeks and then finally testing positive.
Well, the passengers are from more than 50 countries, and as they head home, there are concerns they may create a new wave of global infections. And there are many questions about how Japan has handled this whole affair. Here's one health expert who visited the ship.
Having a halfway protected and halfway unprotected, and that's the most dangerous way of dealing with the infectious disease epidemic. I got shocked and I was scared of having an infection inside the cruise ship, and I still am scared of developing a disease in the next couple of days. I felt much safer when I was in Africa because you know where the virus doesn't exist and you know where the patient is.
Now, that's a reference to working on the Ebola outbreak in West Africa. Well, the US Centers for Disease Control have put out a statement saying the quarantine measures on the ship may have slowed transmission, but it may not have been sufficient to prevent transmission among individuals on the ship. I think we can safely say that's the case. It goes on. The rate of new infections on board, especially among those without symptoms, represents an ongoing risk. Well, some of the pressures on those on board have been heard via social media. One member of staff from India posted this on Facebook earlier in the month saying, "The terror of the virus is increasing at every moment. I request the government take us out of here and isolate us. We should be screened and isolated." But that hasn't happened, and criticism has been mounting. A recent news agency poll in Japan found that more than half of people are not happy with how the Prime Minister has handled this. The government, though, has been defending its decision-making, as has the Japanese Society for Infection Prevention and Control. This professor led its inspection of the vote.
Keeping the passengers and crew on board was appropriate because no large enough quarantine station was available on land. I believe there are good and bad points about how we dealt with the cruise ship. The government will examine and learn from this experience.
Well, Mark Korspeter is a professor at the University of Nebraska College of Public Health. He's been giving me his analysis of how this ship has been handled.
Well, from an external observer standpoint, it appears that there needs to be a reassessment of their quarantine plan for this ship, as it appears to be ongoing spread, at least from someone who's not actually there, who knows everything they know.
Does it look like politics as well as health advice are being factored into the decisions?
Well, I'd like to think that public health policy would be driven by science and what's happening in terms of what they believe the spread to be occurring. But I also understand that politics often does come into play. And when it does, usually it's not really helpful and sometimes can be to the detriment of the actual control of the outbreak.
So do you believe it was a mistake in the first place to quarantine the boat?
Well, I think early on, when it appeared that it might be something that could be contained, it appeared that quarantine might have been a viable option. The question is really, in terms of where the infections are occurring on the boat, was that continuing to be effective? If you think about any outbreak investigation we deal with, one of the key parts to it is ongoing reassessment of our control measures. And if the control measures don't appear to be working, then we need to think of a different policy or different practice.
And I guess now that we have these hundreds of passengers leaving, that throws up new challenges as to how to handle all of their respective cases.
Certainly, if people are leaving the ship, it presents new challenges for others determining, are these people potentially still infected? Do they need to undergo further quarantine, or how do we minimize further spread of the virus beyond the ship?
And in terms of the decision-making process, are you satisfied with the way that an international crisis like this, playing out on a single vessel, is entirely controlled by one government and its considerations?
Well, I think we certainly recognize that any infectious disease does not necessarily respect international borders, and we all kind of live on this planet together. So certainly, although individual countries may have decision-making authority, it's very important that communication and coordination between countries and on an international stage with organizations such as the World Health Organization is very important for the control of a communicable disease such as we're seeing.
Now, there's been a lot of misinformation about this virus from the start. BBC Reality Check has highlighted this map, which has been widely shared. You can see the Sun here saying, horrifying new map shows no country is safe from the coronavirus's deadly tentacles. We also saw Australian TV. Here you can see it says, new map shows where in the world Wuhan residents have gone. The only problem is that map doesn't show anything like that. It's a 10-year-old map showing global air travel, and all those red lines show flight routes. Nothing to do with the virus at all. So if you see it being shared, pay it no attention. If you want a map which points out where the infections are, this would be a better start. We've seen confirmed cases in 27 countries, and they're all marked here in red. So we've heard criticism of Japan. There's been criticism of China too, though the two countries are dealing with that criticism in quite different ways. 3 foreign journalists from the Wall Street Journal have been told to leave China after an opinion piece criticised the Chinese response to the crisis. Here it is with the headline, China is the real sick man of Asia, and it goes on to say its financial markets may even be more dangerous than its wildlife markets, a reference to the possible source of the coronavirus. Well, the authorities say this article is racist, and it's given these journalists 5 days to leave the country, even though, and this is quite a detail, they didn't write the article. Stephen McDonald's in Beijing.
This is the first time in decades that correspondents who have existing credentials have been told, pack up your bags and get out. They've been given 5 days to leave the country. Now, these 3 correspondents had nothing to do with the opinion piece which was carried in the Wall Street Journal describing China as the real sick man of Asia. It could be that there are legitimate grievances with that headline. I mean, people may think that is a racist turn of phrase. But again, these reporters had nothing to do with that. And so that's why there's a lot of analysis wondering what's really going on here. Well, have a look at the timing. It's a day after the US declared these 5 Chinese media outlets inside the United States as being effectively like diplomatic missions. It is highly symbolic. It's like a message from the Trump administration that these media organizations, they're not real reporters. It's like saying you are effectively part of the Communist Party of China. So a day after that, we have these 3 reporters from the Wall Street Journal kicked out. Does seem like quite a coincidence, and many are asking questions about that. Either way, this is bound to cause increased diplomatic tensions between Washington and Beijing.
Well, looking beyond China, the majority of cases elsewhere are involving people who've been to the city of Wuhan, which is right at the centre of the outbreak. Let's look at a couple of examples. In Thailand, we know that more than 130 people were quarantined at a naval base not far from Bangkok. You can see some of them here. They had to be there for 2 weeks after being evacuated from Wuhan. From Thailand to Europe, because we saw the first death recorded there over the weekend. An 80-year-old Chinese tourist died in France, and we know there are 47 other infections there. Also, have a look at this graphic that Reuters has released, showing the way the virus has spread around Europe. We know there are 12 cases in France, but many more suspected cases, 16 in Germany, 3 in Italy, 9 in the UK. Belgium and Finland have 1 case each. Well, outside of China, 7 deaths have been reported, and that includes newly reported deaths in well, not in France, but if I go further to Iran and in Qom to be specific, the World Health Organization says the fact the death toll is as low as 7 outside China is because of measures that are being taken inside China.
Modelization has shown that those measures on movement restriction have delayed the dissemination of the outbreak of 2 or 3 days within China and a few weeks outside China, 2 or 3 weeks. So based on this, then it shows that those measures, if well implemented, could have an impact on the propagation of the outbreak.
And there's much more information on the coronavirus online if you like it, bbc.com/news.